very first COVID jab outside of clinical trials was delivered, and has been talking to the woman who got it as well. A very good morning to you, Dan. So much to talk about.
Yeah, good morning, Louise. I do feel that we've had a bit of a workout today, walking around Coventry Hospital, so I might miss that one from Morning Live a little bit later on. Yeah, the woman you're talking about there is, of course, Maggie Keenan, who's 91 now, and back in December, she was the very first patient anywhere in the world to get a COVID jab. She would speak to the Health Secretary this morning. Delighted to say that Matt Hancock joins us now live on breakfast from our studio down in London. Thank you very much, Health Secretary, for spending a bit of time with us today. Loads to get through with you. Lots of questions from our viewers and from some of the staff at this hospital as well. Can we start, first of all, with the prospect of booster jabs? Because speaking to the man who's in charge of the vaccination centre here in the car park at Coventry Hospital, where they've done thousands of jabs over the last few months, their questions are all about when they will know, how it's going to work, and who will be expected to run it.
Yes, well, we are working on the booster jab programme, the unbelievable success of the vaccination programme, and when we know the results of that, then we will set out the full plans for the booster programme. And so we've got to make sure we get the logistics right. For instance, GPs have been so heavily involved in this vaccination effort. When we get the clinical data through on what's the most effective combinations to have, whether, you know, if you've had 2 AstraZeneca jabs.
OK, so we'll get that detail in the next few weeks. Thank you very much on that issue. Something else, speaking to the chief executive of the hospital here, quite a sort of, I suppose, a startling assessment of the waiting time situation at many hospitals around the UK. Many of our viewers will be experiencing that as well. The Health Secretary this morning as well.
Well, we have got a big and challenging backlog that COVID over the last year, and especially when cases were really high, there were some things that the NHS just couldn't do. There's also millions of people who haven't come forward with a condition that maybe, you know, it might have been niggling rather than acutely serious, and the number of people waiting over a year has started to fall, and that's through the backlog. So we are making some progress against it, but this is going to be a huge effort over the months to come, and it's something that we're very focused on supporting.
Mr. Hancock, years, maybe 10 years. Is he right?
I think we can sort it faster than that. We've already put an extra £1 billion in, and that's one of the reasons why we've been able to get the long-term waits, people waiting more than a year, which were almost zero. They were just, you know, so we've been able to make progress against those longest of waits, but this is going to be a big effort, certainly from the months, maybe for a couple of years, but I think...
Can you fill him and the rest of us in on what is happening with that? Because I sat down with the Prime Minister back in January of last year. There's was meant to be a big meeting with you and him tomorrow. We understand that at Number 10 now say that's not happening.
Well, I meet the Prime Minister all the time to talk about all the areas of my portfolio.
But specifically on social care, Mr. Hancock.
Well, the Prime Minister's commitment is to ensure that we have the plan to tackle social care published this year. There's a huge amount of work that's going on this subject. I'm absolutely not going to get into private conversations and the timing of those. That isn't important. What matters is that we have a clear commitment to resolve this very long-standing issue, and at the same time make sure that we keep the improvements that we've been able to make during the pandemic improved significantly during the pandemic. So there's improvements we can make in the here and now, but there's also a long-term reform agenda that we're working on, and we'll come out with the decisions from that when they're ready.
OK, so just to try and tie you down on that, there will be a plan for social care by the end of this year.
That's right, yes. You can tie me down on that bit. On the internal process, I'm just not going to get into it. Because for your viewers, what I can commit to is the Prime Minister has been absolutely clear that we'll set out the plan for the long-term reform of social care this year, and in the meantime we'll get on with improving it, and in particular the relationship between the NHS and social care, which has got so much stronger during the pandemic. Yeah, the demand's been fantastic, and people are really coming forward and doing their part. And, you know, if I can pay tribute to Margaret Keenan, I saw the video that you've been playing this morning. Since we announced that at the end of last week, we've seen this fantastic demand, people coming forward to get their jabs. And it matters, right? Because we know that the vaccine works. And the more people get jabbed, the more restrictions we can lift. And that is what is really good about this very, very strong demand.
And specifically on that issue, I'm sure you saw Public Health England, Susan Hopkins, suggesting that restrictions could be lifted if we get...
Well, we are looking at the data, and we've said that we'll take a specific look 2 weeks into the 4-week delay that we had to put in place to get more people vaccinated. So we'll do that, and we had to have the delay in order to get more people vaccinated, especially those second vaccines, to protect more people who come forward, the easier that will be. Just to give you one statistic on that, by half the number of people who don't yet have that full protection. That is a big achievement of the team, and all those people coming forward for the crucial second jab, which is so important. So we've done more than 1 million of those second jabs.
Being able to avoid that 10-day isolation and replacing that potentially with daily tests. Is that going to happen? Is there an announcement on that in the near future?
Well, this is something that I'm working on, but I'm taking clinical advice, as you can imagine, because we want to make sure that people are safe and that the systems we have in place are cautious and manage to contain this virus. Want to see, and we will introduce, subject to clinical advice, as soon as it's reasonable to do so. But for now, the most important thing is if you're pinged by the app, get a test. If you're called by test and trace, then you do need to isolate. And the reason that you need to isolate is because you may have the infection. And we've all got used to this idea that if you're a contact, you have to isolate. Because, of course, if you yourself have tested positive, then it's absolutely vital that you isolate. Well, again, on that, we're watching the data. The regulator has said that the jab is safe for children aged 12 and over, and because we want to again be really careful. I have 2 teenage children myself. We've got to know that the jab is safe.
Okay. It's been lovely to speak to you today. I know we're talking a lot about the success of the vaccine programme. With that in mind, and I'm aware this is an awkward conversation for you to be having and an awkward question for me to be asking, but how does it make you feel to know that you have been described as hopeless at your job?
Well, honestly, it feels like ancient history, right? The vaccine programme is a huge success. At times of stress, people say all sorts of things in private. What matters is how well you work together. And you're referring to comments apparently from the Prime Minister. I work with the Prime Minister every single day. We work very strongly together to deliver, firstly, to protect life, and secondly, to get the country out of this. And that's what matters. Okay. And frankly, when you see 72 million vaccines having been done, I concentrate on the future because that's what matters.
Have you had an awkward conversation with the Prime Minister about it? Have you laughed it off? Have you dealt with it at all?
Well, I'm not going to go into my private conversations. I think that's one of the things we've learned from this episode.
Well, but that's the problem. We're learning about these private conversations from Dominic Cummings. I mean, I'll share a bit with you if I can, Health Secretary. I was once called hopeless at my job, but that job at the time was constructing cardboard boxes. And my boss was 17, I think, at the time, and about to go and work in a burger joint instead. You're the Health Secretary, and he's the Prime Minister. Your job could not be more important at the moment. Surely it's embarrassing, isn't it, for your boss, the Prime Minister, to say that about you in whatever context?
No, it isn't really, because of all the things we've delivered together. And we're here talking about the success of the vaccine programme, right? That was something that I very much led from the department, working with the Prime Minister. He's been a massive supporter of it throughout. And, of course, we've had obstacles and we've had people that we've had to, deal with on the way. But what I can tell you is that the delivery of that programme has been absolutely fantastic. And if you look across other areas, whether it's protecting the NHS or working on social care, we work incredibly closely together. And especially over the past 6 or 7 months, especially since after the autumn, I think people can see that the government is delivering for them delivering to get this country out and get us out faster than almost any other country in the world.
As you mentioned, these things have come from WhatsApp messages from Dominic Cummings. Do you know why he has such a low opinion of you?
No, I'm not really very interested. What I can tell you, though, is that the government works far better more recently, and that's a good thing. And you can see it on the smiles of the faces of everybody who leaves a vaccination programme having had their jab.
OK, one final question on this, because I'm interested, when you go back, you actually defended Dominic Cummings at the time of the Barnard Castle trip. Yeah. You called him Dom in that tweet. It sounded friendly. Was there a time you got on?
Oh, yeah. I work with everybody who I need to work with to get stuff done, right? And that's what you have to do, especially in a pandemic. You see, the attitude I have is that, especially in a pandemic, but this is just an attitude to life and to making things happen, is that the best way to do that is by having a team attitude, bringing people together. Yes, sometimes I have to show leadership and say we're going this way, but you want to bring the team with you. You want to encourage people. I want people who are around me to perform at their best, to know that I've got their back and support them. That's the approach that I have. That's the relationship I have with the Prime Minister himself. And that is a far, far better way to run a government. And so that's why I'm kind of, I'm not going to get into the details of who said what when 18 months ago, right? Because what matters and what I'm totally focused on is the future of how we get this country out of this pandemic, how we protect life. Those are the things that really matter. And thankfully, because of the vaccination programme, the chances of this country getting essentially out of this pandemic are higher than they've ever been. And we've been able to do that faster than almost anywhere else on Earth. And I think that the whole team should be very, very proud of that. OK. Health Secretary, I know you spent a lot of time with us this morning. Thank you. I know some of those questions at the end are uncomfortable, but I appreciate your time in answering them as well. So good to speak to you on the programme. Thank you very much, Matt Hancock. Thank you. We'll be back on the roof of Coventry Hospital for you before the end of the programme at 9:15.
Dan's been in Coventry this morning focusing on the coronavirus vaccination programme. Breakfast Graham Satchell has been actually down the road in Rugby, where doctors are trialling a new treatment for so-called long COVID. And it's something that will be familiar to anyone who is into scuba diving. And Graham can explain. Good morning of the programme. You are, of course, watching BBC Breakfast, and it is 8:59.